Today on the Transplant Helper, I'm going to be sitting down to talk with Dr. Corinne Smorra. She's a licensed clinical social worker as well as a therapist. She works with an organization called Heart and Mind Counseling, and I promise you the services she offers to people like you and I, whether it be congenital and or transplant patients, one or the other or both, are absolutely a wonderful thing. And I want her to be able to tell you a little bit about that, tell you about the opportunity she is offering to give us a little bit of wellness, a little farther than that of our physical wellness, and that is to help our minds and help us to deal with the emotional, the trauma, all that comes along with as baggage, basically, the transplant/congenital patient life. So let's jump over in the Zoom call. Let's talk with Dr. Corinne, and I'll see you later. Stay tuned. Hit the subscribe button and the bell notification to become part of the Transplant Helper community. So let's just kick this off really quickly by asking you, Corinne, if you don't mind, tell us a little bit about yourself as well as the services that you offer.
Absolutely. My name is Dr. Corinne Smorra, but I like my clients to call me Corinne. I feel that way we can kind of work together and relate to one another in more of a collaborative fashion because we're both doing some work when we work together.
Right.
I actually am a licensed clinical social worker. I have my doctorate in social work. And currently right now I'm licensed in the states of Alabama, Florida, and Michigan. I have my application in for Georgia right now to be reviewed. So hopefully in the next couple of weeks, I'll be licensed in Georgia as well.
Okay, so what exactly is your primary specialty? I know you said social worker / counselor.
Yes,
What exactly?
My specialty in the clients I work with are congenital and chronic disease, organ transplant, depression, anxiety, and grief, and any type of health issues. So that's really where I specialize. I fell into this because I actually was born with congenital heart disease myself. And when I called Adult Congenital Heart Association, when I was looking at what I was going to do with my third career, I found out that there was only 2 other people that specialized in congenital heart disease from what they told me. One was in Ohio and one was in Canada from a psychosocial perspective. So I went to school and got my master's and my doctorate, and my specialty all the way was psychosocial issues for those with congenital heart disease. And as I started doing my research, it branched out into those with chronic disease, congenital disease, and there isn't a lot of research about congenital heart disease and psychosocial issues. So I started studying about people that experience asthma, diabetes, and things like cystic fibrosis, that is onset at birth. And then I started looking too at what the difference was between a congenital disease and a chronic disease and trying to deal with those kinds of issues, which there is a big difference. Congenital heart disease or congenital disease clients don't remember when they ever felt, quote unquote, fully normal, as a chronic disease person that's been diagnosed with cancer does. So it's different issues to work your way through.
Well, like I've said so many times before here on the channel, I'm definitely someone who's been there and am currently doing that, in that I was born with a congenital heart defect. And I know as a child, there were